Quorum Radio on now with Melinda Hudson, and she's a forgiveness expert. She knows all about forgiveness and also about the perils of unforgiveness. She wrote a book, The Common Denominator is Unforgiveness, and it's connected very, very closely with this whole topic of suffering somatic issues related to problems that happen in interpersonal relationships. Tell us about that, and tell us about your book, Melinda, and thank you for being on Quorum Radio, WRMI.
Thank you very much. The book, The Common Denominator is Unforgiveness, is, like you said, it's not only about forgiveness, but it's about what happens when we don't forgive. How does our body, how does our subconscious mind respond to triggers that are related to negative events in our life? So growing up, you and I, or whatever, we always thought of forgiveness and would relate it to religion. This has nothing to do with religion. It has to do with what happens to your mind and what happens to your body when you don't forgive. So scientists have been studying it for 30 years, and they have the evidence now to tell us that about 75% of our medical problems come from unforgiveness.
Wow.
Do you have
so
any
then, what kind of problems, Melinda? What type of symptoms? What types of issues?
Okay, we'll start down low. Autoimmune problems. So your body doesn't respond to the COVID virus and you get really sick. You know, gastric problems, increased blood pressure, increased cholesterol, heart attacks, cancer, fibromyalgia, almost anything you could think of. So
then now, my understanding is that your book, which is the Common Denominator is Unforgiveness, actually is buttressed by scientific proof that unforgiveness has real consequences. Is it kind of like an empirical based given that unforgiveness causes health problems?
Yes, it definitely is now. You know, they didn't know in the past, but now scientists know that there's definitely the link between the mind and the body. And so once the subconscious mind has the information in there from that event and from that person that was involved in the event, and say you've got bitterness and anger in your mind, in your subconscious mind, what happens is we know now that you receive triggers. And trigger can be something that is a smell, it can be a taste, it can be a sound, but that trigger reminds your subconscious mind of that event. Now, you don't know this is going on. This is all going on in the subconscious mind. But when it does that, then you recall the event and you release the hormones, but the hormones aren't utilized because the event isn't happening. So over time, what happens to the hormones? They increase, and it makes your body become toxic, literally toxic.
Wow, incredible. Now, you mentioned, I believe, an anecdote about somebody who apparently went through, let's say, your forgiveness therapy, if you will, the forgiveness steps, because I understand your book, The Common Denominator is Unforgiveness, is that it actually deals with kind of like a before and after scenario of somebody who had cancer. And tell us about that.
Right. So throughout the book, actually, there are examples of individuals or groups of individuals that were in research projects. For example, there was one group that there were 53 people that had cancer, and once a month, and they forgave, and then once a month for I think 4 months, they would do a CAT scan, and every one of them, their tumors shrunk each month.
Wow. Who conducted this study? Where was it done, Melinda?
Dr. Toussaint, Lauren Toussaint conducted the study, and it was done at the Lutheran Hospital. He is a professor at the Lutheran College, and it was done there.
And what state is that?
That's a good question. For some reason, I want to say...
Is it Texas?
I want to say Utah, but I may be wrong about that.
All right, no problem. It's yeah, sorry, silly me.
That's
okay.
Okay.
That's okay. But more importantly, though, it's a fascinating thing. So in other words, they saw shrinkage in the tumor sizes, right, in the CAT scans?
Right. And actually, there's a doctor in here by the name, or in the book about, his name is Dr. Gaber, let's see, Dr. Gates. And he basically had a doctor friend of his that for 4 years kept telling him that he complained of having all these medical problems. And his friend for 4 years said, you've got to forgive, you've got to forgive. And he would tell him, like, leave me alone. I don't want to hear that. That's not for me, you know? Yeah. Kind of one of those things that some of us do sometimes. Well, finally he got desperate and he called him. And he said, I'm not doing well at all. And so sure enough, he forgave. And I have, his story in the book, and it's quoted, it's exactly what he said. But basically, every problem that he had went away.
Amazing. And tell us, go through some of the problems that he had.
So, okay, I'm doing this off the top of my head, but I'm pretty sure that he had diabetes. Now, he would have had diabetes type 2 because that means his beta cells were still functioning, but he still forgave. And by forgiving, then our bodies they always want to be in homeostasis. They want to be equal. They want all of our hormones equal, everything equal. And when things are equal, then they can take care of themselves. And so what happens is, like we were just talking about, when you don't forgive, we get unbalanced in the chemicals. But he had diabetes. I believe he had a lot of back problems and problems with his neck. And they went away. Seems like he had a couple other problems, but he has also been treating his patients and have seen with them numerous cases of diabetes, cases of high blood pressure, cases of patients with high cholesterol, cancer, like we were talking about before. There's been several studies, a lot of studies that have been done with cancer, as a matter of fact. So the bottom line is, if you think about our body, if you think about when you get a cut, for example, your body can heal itself automatically. You don't have to do anything. It's got the clotting, and then it's got the leukocytes that come, and then the T cells that come and gobble up anything that's nasty, around it. Sure. And then after that, we've got the skin that starts to form, but it forms a scab at first, so it protects the skin underneath it. All of that happens, and it happens without you doing anything. Well, that's the case throughout our bodies. We have cells inside of our bodies that can kill cancer. So every day, I'm not saying that it happens every day, but there could be every day for a month or two that these cells are killing cancer in your body. As long as you're in homeostasis, our bodies, when they get out, they can't work.
Okay, right now, the American medical profession has seen so many different types of, let's say, alternative therapies.
Right.
And so many different approaches.
Mm-hmm.
How receptive is American medicine to these findings?
I think I was reading something yesterday. They are open to it, but so the doctors that I've talked to are open to it. But, they get paid for their people coming in and being sick. So to tell them this is what you can do to be well is probably not something they're going to do.
Not good for business.
Exactly. It's not good for business. I say doctors Band-Aid problems. You go into your doctor, you say, doctor, I'm having problems sleeping. Well, are you going to bed late? Are you waking up in the middle of the night? They'll ask you a few questions like that, but they don't ask you, well, tell me what's going on in your life right now.
Oh my goodness.
So you and your wife are having problems and she actually left you. Uh-huh.
Wow, okay. You're angry.
So yes, exactly. You're angry, you're bitter. Tell me some other feelings that you feel. And so then they connect the not being able to sleep with the anger and the bitterness. And so instead of throwing medication on top of the problem and not even knowing what the problem is, that's kind of how they fix everything.
Wow, amazing. So, and I have faith that the general practitioners, the family doctors, the GPs would be receptive to this. because people come to them to go back to them again and again, because I go to my doctor because he or she helps us be better,
Right. Right. And to be honest with you, I hope that I am trying to put a program together to present to hospitals, especially in the cancer areas where they've got some time where they'll be following them. But even without, going in and talking to patients, and if they're willing to listen and hear about forgiveness, give them the information. That's one of my goals, is to put something together so that the hospitals will have it available as forgiveness therapy, if you want to think about,
Well,
that
amazing.
way.
I mean, it's a fantastic idea. And I think that you're former, well, I don't know if you're currently practicing or not, but I know you were a nurse. Is it pretty common to come into situations where you have a patient with lots of maladies and they're just trying to deal with it? And to me, they seem like they'd be perfect for this therapy.
Oh yeah. I mean, it's been so interesting for me over the last 5 years plus now, and that I've written the book and have talked to people. I can't even tell you, I would say at least 20 young people. And when I say young, I would say in their mid-20s to say 30s, mid-30s, that I've talked to, and I've said, can I talk to you about forgiveness? And so I give them the spiel, and initially everybody will say, no, I'm not going to forgive them. You don't understand what they've done to me. And
Ooh,
then
wow,
as soon as you say, well, let me ask you this, if you have any medical problems that are currently going on. And a lot of times, even the young people will have like autoimmune problems. That's probably the one that I hear the most. And so I tell them, or I say to them, your body doesn't want to be sick, but the anger and hostility that you're holding inside that you don't realize is basically, that's what's causing it to happen. So
one other question.
Forgive.
Mm-hmm. Melinda, I have a question. I just thought of something. I don't want to forget it. Allergies. We're seeing this just like an avalanche of allergies in young people, to peanuts and all sorts of different food additives, and peanuts is what comes to mind. And then because we grew up eating peanut butter, that was just like every day, But there's also other things, seafood and fragrances and any type of little thing. And then it's common for kids to have allergies, and it makes them miserable. And their families are just in a real dilemma about, I don't know what I can do with my son or my daughter, because anything can trigger an allergic reaction, and it's life-threatening. What about that? Is there a connection between allergies and unforgiveness?
I might be able to take you another direction on that one. I can't say that I have read anything on allergies. So I will not try to connect it, because with unforgiveness, it gets triggered. And when it gets triggered, then it causes the problem. Allergies, I don't really associate with any kind of problem in relation to, for whatever reason, I don't. But I will tell you that there are things out there that are pretty good on the holistic side, like colloidal silver, for example. I mean, I'm huge on colloidal silver. I didn't know about it until the virus, but it's interesting because silver goes back to BC. And they found out that the people that were eating with silver, on silver plates, with silver utensils, they stayed healthier than the other people. So it took them a while to figure it out, but they did. Yeah. And so they actually had children suck on silver coins. That's where the silver spoon came from. So then we have the father of medicine, Hippocrates. He actually used silver as an antibiotic. That was the way they initially were using it, as an antibiotic. And so that rolled into when we started using antibiotics. And of course, the big pharma and I was like, okay, now we're not going to use colloidal silver anymore because we have this. So the interesting thing about it is, it's now they've determined that it will kill viruses and funguses. So there's numerous studies that will, and you know, the FDA will do everything they can to not let that be out there. I even noticed at, when we first got this colloidal silver, I went to Walgreens and they had taken it out of the stores. So I go to the pharmacist and I said, can you tell me why they're taking the colloidal silver out of the stores? And she said, because, this is what she said, because it will turn you blue and it's toxic. And I said, really? You know, there's been one person that has turned blue. He was on the Oprah show many, many years ago, and Dr. Oz, and he tells them he was drinking it by, you know, every single day. Yes. And he made his own too. So that was another issue. And of course, any kind of medication can be toxic if you take too much. But what they have found is, and you know, they've done studies with Ebola. It kills Ebola. It kills HIV. They just won't let the information out.
Well, Melinda, let me tell you something. You're somebody who knows a lot about a number of alternatives to deal with, you know, current health crises and emergencies. The book, of course, again, is the basic denominator is unforgiveness. It's available, I guess, on Amazon and all places like that. Where else can they get it? Is it basically on Amazon, or where? Where can they go and get your book?
Amazon, Barnes and Nobles. I've heard Target. They can also go on melindacares.com, the website, and get it there.
Okay.
So there.
Do you have a picture? Do you have the book with you right now?
I actually do. This is the one
Hold
that
it up so we can all see. Hold it up, Melinda, so we can all see it.
Can you see it?
The common denominator is unforgiveness. High blood pressure, anxiety, heart attack, back pain, headache, cancer, depression. Unforgiveness is involved. So get this book. It's also a great gift for Christmas, you know. And people will say, well, gee, you know, maybe I have all these health problems and maybe I should read what's inside it, but I have to buy it first. So get it for Christmas. It's a great gift for your spouse or a member of the family that might be able to benefit, or maybe give it to somebody who maybe knows that maybe they need to forgive and could benefit as a result. So anyway, hey, listen, thanks so much for being on WRMI Quorum Radio. Melinda Hudson, Godspeed to you and your great projects to help America get healthy through unforgiveness. Thanks a lot. You have a good day now.
Thank you. You too.